Welcome to KDH Counseling's Leaning into Therapy series, where we explore therapeutic approaches and evidence-based protocols to give clients the most comprehensive understanding of therapy. Our goal is to empower clients with research-based interventions so they can make informed choices about their treatment. Join KD Holmes, a licensed professional counselor with 16 years of experience, and her team of clinicians as they share their expertise, insights, and therapeutic interventions. Get ready to delve into the world of therapy in this series specifically designed for clients by therapists. I'm excited today. I have one of our newest team members at KDH Counseling, and she is going to tell us a little bit about herself. I'm KD. I'm the owner of KDH. I've been doing therapy for a long time. And I like to interview people when they start working here. So today I have Brent Nicolini. I always say it wrong. Is that right?
Got it right.
Woo! Okay, I got Brent. I'm excited. So, Brent, will you tell us a little bit about yourself?
Um, I am a licensed professional counselor and a licensed addictions counselor. I have been working in the addictions field for over 10 years now. But I also work with other, mental health disorders. And that's what I do.
Well, we are excited to have you. You are our first addiction educated therapist. I don't even know what to say, but like somebody that works with addiction, like specifically. So I'm really excited because that includes codependency, it includes loved ones of alcoholics or addicts, it includes the addicts themselves, it includes children whose parents were addicts or alcoholics and maybe have trauma from that. I mean, it's a lot of people who are affected. So I'm excited. Will you tell us today, how did you get into therapy?
So in 2010, I sought help for my own addiction. And when I was about a year sober, I was given the opportunity to start studying for addictions through the ADRA program. I had a CEO who believed in me to be a counselor. So she would pay for the classes. I had to pay for the licensing, and she was my supervisor. And from there, I started working as a CIT. And I went back to yes,
I was going to say, can you say what a CIT is? People aren't going to know what that is.
it's a counselor in training. So I started out as a CIT, and from there, I continued my addictions education. So I went back to the facility where I was a client, and I started working there. And I started working there as the house cleaner. And so there I worked part time as the house cleaner, and then I was also a counselor in training. I continued on and on. There's a requirement of so many thousands of hours that you have to get. And then I became a registered addictions counselor. Worked in the addiction fields. I worked in treatment facilities of a variety of kinds of treatment centers. And then I decided at the age of 51 that I would go get my master's degree. So I did it. And because I wanted to learn about the underlying mental disorders that are associated with addiction. Addiction, there's anxiety and depression, and all they're interrelated and they're connected. So I felt I needed to learn more about those mental health disorders. So then I went and got my LPC, and it's really helped me to understand that whole realm of just what's connected to the addiction and just mental health disorders in general.
Well, and the LPC, that's what I am as well. So that's a licensed professional counselor.
Yes.
And that's just, you have to go back to school, get your master's. I mean, it's a long process, and then you have to be
Mm-hmm.
supervised. It's long, but it has given you a greater understanding of all the mental health issues that are feeding that addictive process. Is that how you'd say it?
Absolutely. That's why I went to grad school, was to learn so I could learn more about these mental health disorders that are associated with addiction or even without association with addiction. So, and then from there, I got the licensed professional counselor, and then I went back, and with a master's, you can retest. There are a lot of tests involved for licensed addiction counselors. So that's how I got. You have to have a master's to be licensed in any profession in
Awesome.
mental
That's
health. Yeah.
awesome. So, and I actually started out in counseling in a similar, so I was going to be a substance abuse counselor. I started the CIT thing, counselor in training, and then I realized I'm really not good at substance abuse counseling. And so I went back to school quicker. I went back to school like almost immediately, and got my master's in counseling. So we have similar histories. And
Mm-hmm.
I had a little drug problem when I was younger, and was sober for like 8 years. So there are some similarities that I just think make, maybe it's why I like you so much. I don't know. There's something about the way we think about things that's very similar. My next question I wanted to ask you was, what do you work with? Because we talked about substance abuse, but I feel like that's just one of the many things you work with.
So I work with people who are 18 years or older, a variety of mental health disorders, trauma, depression, anxiety, grief, addiction, of course, and most mental health disorders. Because the mental health disorder is usually the root of or the trauma is the root of why we go and become addicts or whatever else. So, and even though it's not associated, some aren't associated with, like, depression can just be associated with other types of trauma or whatever is going on in the client's life. So codependency, I don't work with couples per se, just because I work with individuals, and that may change, but for now, I just work with the individuals.
That's funny. So I tried to work with couples for a little while too. And it's just not my thing. I'm an individual therapist. I mean, it might change for you, but I just love that individual dynamic, trying to explore what's going on inside of them and what's motivating whatever the issue is in their life, motivating good or bad, right?
Yeah.
Um, so what do you use to treat these things? I know we didn't talk about this, but I wanted you to say it. When it comes to trauma, what are your favorite approaches to treating trauma?
So, good old narrative therapy. I am trained in EMDR, but I really prefer brain spotting, which I'm trained in. Brain spotting, just a quick definition, is it's a focus on an eye point, that your eyes focus on a point. Your optic nerve is directly connected to your midbrain, which holds emotions, trauma, survival responses, and things like that. And it's tucked away in the midbrain. And focusing on where you look can unstick some of that, for lack of a better term. And then we can work with that. A lot of our survival skills are, we repress, we avoid, and we think we can just tuck that down, but it's bothering us on a daily basis, and we may not recognize that. So, brain spotting is a good way to sort of get to what's right in front of you. EMDR is a great process. You have to go a little bit farther back in your life, but we can brain spot if whatever's in front of you right now, which is I really like that. Let's get what's right there right now.
And we will do a video on this later. We're going to talk about deep brain reorienting and brain spotting because I'm very curious about brain spotting. I know just a little bit about it. But that's just one of the techniques you use, right? And
Mm-hmm.
you said narrative therapy. Anything else?
CBT, all the behavioral therapies, that's cognitive behavioral therapy, dialectical behavior therapy. I find that behavioral therapies, in conjunction with other types, you can use ACT and work with values and things like that, really kind of help, sort of an eclectic approach. I use different things to try to get to self-discovery, and help the client find out, what's going on inside.
I like that. Well, and I love a behavioral approach. Again, I wonder if it's like that, both of that substance abuse sort of history stuff. Those behavioral approaches are so intentional. I love them as well, right? They're tangible tasks that our clients can use.
I mean, we are what we think, right? I'm
Mhm.
going to act the way I think. So if we can help shift some of that, then maybe that helps with my reactions or some of my thinking, my thought process.
I like that. So we talked about this. How do you work with a client? We already talked about it. We had some questions we were going to ask. This was it, right? Any other ways that you work with your clients? Because the
Um,
self-discovery piece, when we talk, that is like a very important part of what you do.
so in my approach, I try to use a collaborative approach. I work with the client. Listen, I don't know magic. I can't change people. I can hardly change myself on days. So it's a collaborative approach for like an honest search for self-discovery, and acceptance, and healing. So I work with the client, so we can explore and discover what the client already has inside of them to find healing and live a fuller life. It's not a happier life. It's an understanding of your life and an understanding of where you are today and what you're trying to work for in the future, right? So if I have a problem with anger, that self-discovery and awareness can help me to understand, well, how can I change some of that anger? How do I facilitate change in my life? And it's still awareness, So if I know I'm going into a situation that's going to make me angry, what tools am I going to use to not walk away upset, angry, or yelling at people? It takes practice. Everything takes practice.
I like that, but it sounds like the broader goal, like the specific task might be managing anger, but the broader goal is self-discovery and meaning. So it's not necessarily that we're working towards a happier life. It might be a side effect of it, but
You're
it's
right.
a more aware, more meaningful life.
And understanding about who I am and how I operate in the world of daily life.
I like that. It's very introspective. So are there any other things you'd like to say about to people who might want to see you? Any other things that really describe you as a therapist?
I'm honest. I'm thorough. I'm direct. I don't sugarcoat things. I think that effective communication is key in everything we do. So I'm going to be effectively communicating with my clients. If I see something or I can say something to help you make a connection,
Mhm.
I'm going to say it. You know, I just take an honest approach. This is what you see. This is what you get. Um, Sometimes I'll self-disclose, to help clients move forward in trust. I think rapport building in the beginning is absolutely the foundation of any sort of therapeutic relationship. So I try to be open and direct as possible.
Well, and I want to say that's probably one of the things I like most about you is that you're direct, but you're kind. I think sometimes therapists get really, I don't know, scared of directness. Like direct means mean. It's really fascinating to me. I'm like, no, you can be very warm and kind and direct. And one of the
Mm-hmm.
things that I get from you in our conversations is that you're kind, you're direct, you're even playful. But you're really honest if something is coming up or you're thinking about something. And I think that creates a really safe environment for people that work with you.
Yeah, absolutely. And humor. I mean, sometimes I have to use humor sometimes when we get a little stuck, we have to laugh at ourselves and at others sometimes.
Yes, I like that. And at others, that's helpful.
Right.
Well, I'm excited to have you here. I'm really, really happy that you're working here. So if anybody
Thank you.
wants to learn more, we'll have more videos where we dissect what we think about counseling.
Okay.
Bye.